Anulom Vilom, mental. Anulom Vilom is also called as alternate nostril breathing because we are alternatively breathing from the nostrils. Okay. In this, what we do is we will not be using our thumb and index finger like we normally do in alternate nostril breathing. We shall try to do it mentally. So we will inhale from, let's say, the left nostril, exhale from the right, then inhale from the right, exhale from the left, inhale from the left, and continue. Now, you cannot do this perfectly well, but you can make it so that the air is going from your left nostril, from the outer walls, from the inside, but outside. Okay, and when you exhale, it's coming from like kind of curved like that. Okay, so let's try to do this. There's no way you're going to tell I'm doing it, but let's just do it a few times. And when you exhale, slowly release. So, it's, one might ask, how do I do this? So it's just like this, some people, you can focus on the muscle in your ear and you can lift the ear. You can focus on the muscle of your eye and lift one eyebrow, right? Same way you can focus on the muscles of your nose and basically inhale from that nostril. Focus on the muscles of your right nostril and exhale from there. Focus on the muscles of the right nostril and inhale from there. And with practice, you'll be able to do Anulom Vilom mentally. And Anulom Vilom is a very beneficial breathing exercise because it helps to focus and balance our mind. When the mind is well balanced, it relaxes our body, and the body heals when it is relaxed. Mixture of flows, downward dog. Let's go into Bhujangasana. Bend your elbows, inhale into cobra, the legs do not touch the floor. Exhale, downward dog. Inhale, cobra, exhale, downward dog. Once more. Go back into downward dog, stay in downward dog, raise your right leg, bring the right knee to the right elbow. Inhale up, exhale, right knee to the left elbow. Do this 2 more times. Inhale, exhale, inhale, exhale. And going up, now coming into pigeon. Bring your right leg on the floor and slowly extend your arms forward, lean forward and relax with the forehead on the floor. Breathe in, breathe out. Stay here for 5 ujjayis. Enjoy the stretch in the leg muscles, lower back. Breathe in, breathe out. Walk your hands back, raise your torso, go back into downward dog. Let's do 3 downward dog to cobra flows. Inhale, Bhujangasana, exhale, downward dog. Inhale, Bhujangasana, exhale, downward dog. Once more. And now let's raise the left leg nice and high. Left knee to the left elbow. Inhale up, exhale, left knee to the right elbow. Inhale up. 2 more times. Inhale, exhale, raise the leg, go into pigeon. Bring your left leg on the floor, thighs in line with the edge of the mat. Leaning your body forward, bringing the forehead on the floor. Stay here for 5 ujjayis. Inhale and exhale, making the ocean wave sound. Raise your head, walk your hands back. Let's go back into downward dog. And let's get ready to do 3 more downward dog to cobra flows. Bend the elbows, inhale into cobra. Exhale, downward dog. Inhale, cobra. Exhale, downward dog. One last time. Exhale, and then bend your knees. Spread your knees wide apart. and slide your body into child pose. Completely relax. Maintain this for 5 to 10 breaths. Take deep breaths. The heart rate has increased in this exercise. By taking deep breaths, you can calm yourself down. Windshield wiper. We shall do the windshield wiper pose. Let's start by lying on our backs with both legs stretched out. Extend your arms over the head on the floor. The arms are 120 degrees apart, just like your car windshield wiper. Now slowly bend both the knees and place your feet flat on the floor. The feet should be about 3 feet apart and almost off the mat. Gently tuck the right knee in towards your left foot. Stretch the right arm and the right thigh. Look towards your right side, or if you find it more comfortable, you may just look straight in the center. The closer the knees to the floor, you will get a better stretch in your lower back and thigh muscles. Enjoy your breathing and the stretch in the right half of your body. Observe how your left side is completely relaxed. After 10 to 20 breaths, slowly raise your right knee. Now gently tuck the left knee in towards the right foot. You may turn your head towards the left side. And once again, enjoy the stretch in the left thigh, lower back, and the left shoulder region. Stay focused on your stretches and your diaphragmatic breathing. Once again, observe how half your body is stretched and the other half is completely relaxed. Breathe in, breathe out. You may close your eyes and enjoy this posture. The closer the knees to the floor, you'll get a better stretch in your SI joint region in the lower back. Now to release, slowly raise the left leg. Stretch both the legs, bring them together. Bring your arms back on the mat and relax. Setu. Setu means bridge in Sanskrit. One should avoid this posture in case of neck injury and recent knee injury. Begin by lying flat on the mat. Bend the knees, placing your feet flat on the floor, and position them a few inches apart. The feet should be directly underneath the knees and your knees should not be jutting out. The lower legs should be perpendicular to the floor, so pressing your feet and arms into the mat, raise your hips as you inhale. Interlace your fingers and stretch out your arms. Maneuver your shoulders and come up even higher if you can. Let's stay in this position for 10 to 20 ujjayis or ocean breaths. Now let me talk about a little bit of the flaw that can happen with the knees. So if your feet are very close to the hips, so if you can, Alexa, walk your feet towards your hips and then lift your hips off the ground, you notice how the knees are jutting out. We don't want that happening. So you want to come back down. Make sure your feet are directly underneath the knees. The feet are slightly apart. Okay, and the inner thighs are parallel, inner feet are parallel. Lift the hips off the ground, interlace the fingers, stretch your arms out, and maintain this position. Enjoy the stretch in the back muscles and leg muscles. This posture increases the blood circulation in your upper body, energizes the thyroid, and opens up the chest, giving you lungs more room to expand and thereby facilitate breathing. This is a wonderful pose to observe your diaphragmatic breathing. Observe as you inhale, your belly rises. As you exhale, the belly comes back down. This posture gives instant relief for people that are experiencing lower back pain or sciatica pain. To release, come out of the posture. Bring the hips on the ground, stretch your legs out. Release your arms and completely relax. Purna Dhanurasana. In Sanskrit, Purna means full or complete and Dhanur means bow. This is an advanced version of bow pose. Full bow pose should not be performed with any back injury, shoulder problems, and carefully with knee injuries. Begin by lying on your belly and chin on your mat and entering bow pose. Bend the knees and stretch your arms backwards to grasp the inside of the feet or the big toes. Upon inhalation, rotate your shoulders and pull your legs upward, raising your upper body off the floor. Raise yourself as high as you can within your capacity. Remain here for a few breaths, focusing on your balance. This pose stretches the back, buttocks, the thighs, and stimulates the spine. It expands the chest, the shoulders, and improves lung capacity. We are energizing our pancreas, kidneys, uterus, urinary bladder, and the liver. It also helps to tone the abdominal muscles. Be aware of your diaphragmatic breathing. To come out of this posture, release your arms, legs. Come back on the floor, turn your head to one side and completely relax. Salabasana. Salab means locust or grasshopper in Sanskrit. Let's start by lying on the mat with the chin on the mat. Make gentle fists of your hands. Take the thumb in and roll the fingers on top. Now place your fists underneath the groin region for support. Make sure your fists do not touch each other. Stretch both the legs and raise them as high as you can or around 45 degrees. Maintain this for 10 to 20 breaths. Be aware of the stretch in your lower back and the leg muscles. Chin stays on the mat throughout the posture. Make sure your upper body is completely relaxed. Be aware of your breathing. Inhale and exhale. If you prefer, you may do Ujjayi's, ocean breath. Inhale, making the ocean wave sound. Exhale, making the ocean wave sound. As you exhale, slowly release the legs, hands. Turn your head to the other side and completely relax. Supta Vajrasana. Supt means easy in Sanskrit, while Vajra means thunderbolt. Avoid this posture if you have neck, spinal, or knee injuries. This is an advanced yoga posture, so please perform it with a lot of care. Let's begin in Vajrasana with your hips resting on your heels. Place your hands on the floor near the feet with the fingers pointing towards the toes. Now slowly as you exhale, lean back, bringing your elbows on the floor. Now release your elbows from the floor and bring the top of the head to rest on the floor. Let your palms rest on the floor facing down. Back forms a nice arch. Stay in this position for 10 to 20 breaths or as per your capacity. Be aware of your breathing and the wonderful stretch in the lower back, shoulders, neck, and leg muscles. Observe how the chest has expanded. This posture stimulates the thyroid, thymus, pancreas, kidneys, spleen, gonads, pelvis, and the liver. Observe your breathing. Your arms are completely relaxed. As you inhale, the lungs fill up with air, the belly rises, the ribcage expands slightly. As you exhale, the lungs empty, belly goes in, and the ribcage contracts back. Breathe in, breathe out. To release, slowly turn your body to one side. Stretch your legs out. Rest your body on the side for a couple of breaths. And then slowly come into a sitting posture. Stretch your legs out. Keep them slightly apart. And rotate and flex your ankle joints. Breathe in, breathe out. And then slowly release and relax in Dandasana. Malasana, garland pose walk. Avoid Malasana or garland pose if you have had knee surgery or are experiencing severe knee pain. Sit in a squatting position with your feet wide apart. Try to bring your heels on the floor. If it is difficult, just keep them raised. Make a namaste with your hands and now walk. Do this for about a minute or as per your capacity. In this posture, we are compressing and energizing our digestive organs, strengthening the leg muscles and strengthening our knee joints. Slowly walk back to your mat. Come back to the starting position. Release your arms, legs, and come into seated positions. If you like, you can even stretch your legs out and sit in Dandasana and relax. Vipritkarni. Viprit means opposite in Sanskrit. This is the inverted pose. Please avoid this posture if you have high blood pressure, glaucoma, or are menstruating. Let's begin by first stretching both the legs. Gently raise the legs through 45 degrees, 90, and then extend the feet beyond the head until the legs are parallel to the floor. Support your hips with your hands. The elbows should be shoulder width apart. Raise the legs vertically in the air. Make sure that you maintain about a 45-degree angle between the legs and your torso. So bring your legs slightly lower. Because if you keep your legs perpendicular to the floor, there is excessive weight on the elbows. Maintain this for 30 to 60 breaths. This posture increases blood circulation in the upper body, relieves varicose veins, energizes the thyroid and parathyroid glands, releases pressure in the groin and lower abdominal region, keeps the uterus in a healthy condition, and prevents displacement of abdominal organs and hernia, improves functions of the gonad and adrenal glands, adds glow to the face, and clears out facial acne and pimples. To release, slowly take the legs over the head parallel to the floor. With full control, gently bring the hips on the floor and release the legs. Straighten your legs out and relax. We should now do two counter poses. One is the half fish. Slowly place your hands underneath your hips or the sacral region. Using your elbows, bring the top of the head onto the floor and uncurl the neck. Stay here for about 5 breaths. Breathe in, breathe out. Slowly release. Release your arms, relax. And we shall do the threading the needle. Bend one knee, place the other foot. Take the arm in between and hold on to the outside of the knee. Bring the knee close to the floor. When you do Vipritkarni, what happens is there's an arch in the middle back that's formed. And when you do this complementary posture, you're trying to flatten that part of the back. Breathe in, breathe out. Slowly release. Let's go to the other side. Squeeze the knees close to the chest. Enjoy the stretch in the outer thighs. Be aware of the flattening of your middle back. Breathe in, breathe out. And now slowly release, stretch your legs out. And finally you can do the neck out stretch lying down. So inhale, turn your head to one side. Exhale, bring the head back to the center. Inhale, turn your head to the other side. Exhale to the center. Do this a couple more times. And slowly come back to the center position. Shavasana. Let's begin by lying on the floor. Feet are 10 to 18 inches apart. Palms facing the sky, fingers gently curled. Find a comfortable position for your head. Let's begin this mental relaxation, starting with the legs. Relax the feet, the lower legs, knee joints, thighs. Relax your hip joints, pelvis, abdominal muscles, chest muscles. Relax the shoulders and relax each and every vertebrae of yours. Relax the buttocks. Let's bring our awareness to the arms and send a wave of relaxation through all the muscles in both your arms. Relax your neck muscles, facial muscles, your eyes, eyelids, eyebrows. Bring your awareness to the head and relax the entire skull region. And observe your breathing, the smooth and steady breathing. If there is any part in your body that needs that extra relaxation, you may relax it now. Otherwise, stay focused on your breathing. To release, slowly wriggle your fingers and your toes. Gently turn on to your left side or your right side. Place your hand underneath the head, making a pillow out of it, and slowly come into a sitting position. Let's rub our palms, make them nice and warm. Place them on the eyes. Let the warmth flow from the palms to the eyes. Release the hands. Place them on the knees. Open your eyes.